The following paid commercial program does not reflect the opinions and views of Nexstar Media Incorporated, this station, or their employees and its affiliates.
Tonight, Medicaid is a lifeline, ensuring access to quality health care for you and your family. Learn what you need to do to renew your benefits on Stay Covered PA. Sponsored by the Pennsylvania Department of Human Services and Penny, PA's health insurance marketplace.
Good evening, I'm Valerie Pritchett. Tonight we are here to make sure Pennsylvanians stay covered with health insurance. People who get health care through Medicaid or the Children's Health Insurance Program, also known as CHIP, must renew that coverage each year. In Pennsylvania, more than 3.7 million people, a little over a fifth of the population, are enrolled in Medicaid and CHIP. Pennsylvania's Department of Human Services Secretary is here to answer important questions like, why do Medicaid recipients need to renew their policies? How can people renew their benefits? And what happens when someone is no longer eligible for Medicaid or CHIP? We will answer those questions tonight. And if you have questions at home, Deborah Pinkerton is here with how to get them answered. Deborah.
Hi, Valerie. Representatives with the Department of Human Services and Penny are here answering your web chat questions live right now. If you have a question, you can submit your question to abc27.com/staycoveredpa. We will share some of the questions coming in throughout the show. Back to you, Valerie.
Thank you, Deborah. Joining me now is Valerie Arkush, Pennsylvania's Department of Human Services Secretary. So what changed about Medicaid renewals?
Well, what changed about Medicaid renewals this year is that our Medicaid enrollees must complete their paperwork to do their renewal. During the COVID-19 pandemic, the federal government changed the rules so people didn't have to send that paperwork back. We continued to send those enrollment packets to them, but if they didn't send it back or they were making too much money to qualify, we still kept them on their Medicaid. This year, that changes.
All right, so where did this change come from?
Well, as the pandemic came to an end, Congress in Washington, D.C. Determined that many of these flexibilities that were allowed during the pandemic would come to an end. And so starting just this past April, we have been starting to reach out to all of our Medicaid enrollees, anyone who gets their health insurance through the state, to let them know we need them to fill out that paperwork or they might lose their coverage.
And so what do people have to renew Medicaid coverage? How are they going to go about that?
So there's several different ways they can do it. They're going to get a packet in the mail from the Pennsylvania Department of Human Services, so we want to make sure they open that. They can complete that paperwork. If they need help, they can go to a county assistance office. They can also call by phone and do it over the phone. And people can get those numbers, get those locations at dhs.pa.gov/staycovered.
Right, and as you mentioned, the process to renew Medicaid and CHIP benefits can be a bit daunting at times. So DHS is here to help people stay covered. Deborah Pinkerton is here to explain that whole renewal process. Deborah.
Thanks, Valerie. We heard the Secretary say annual renewals are required by the federal government, but Pennsylvania tries to make that process as simple as possible. The state provides more than one way to complete the Medicaid or CHIP renewal. Take a look. By mail, online, over the phone, or in person. This is how the Department of Human Services will reach out to you when it is almost time to renew your Medicaid and Children's Health Insurance Program, also known as CHIP.
About 90 days before the renewal is due, you're going to start receiving communications from the department asking you to update your contact information. Your contact information can mean your email address, your physical mailing address, it could mean your phone number, anything that can help us reach you more readily so that you can get through the process as easy as can be.
You'll hear from DHS via mail, and if possible by phone, text, and email, telling you to keep your contact information up to date and report life changes like a new job, a change in your household, and if you got married or are pregnant. There is a benefit to updating your case information early.
So what that also does is gives us the ability to potentially automatically renew people instead of having to send them a renewal packet. So updating information at the time and at that 90-day mark is really important.
If you miss the 90-day notice, you will receive another notification by mail and phone, email, text, or blast call.
At the 60-day mark, people will receive communications from the department that let them know the renewal is coming, but that they can do it now. The ability to do a renewal on Compass or by phone exists at the 60-day mark. So if individuals want to take action on their own part to go ahead and do that renewal, they can right then.
Compass is an online way for individuals to manage their Medicaid and CHIP accounts.
So Compass is our online benefit system. So if individuals want to go online to do benefit actions for the department, they can do so on Compass. The location of it is dhs.pa.gov/Compass, and individuals can renew, they can update their information there, they can submit applications. There's a lot of different actions individuals can take on Compass.
You can also start your renewal early over the phone. If you're not able to renew your application online or over the phone, a renewal packet will arrive in the mail.
So at 30 days out, the renewal will be mailed to the household that's up for renewal. And at that time, that individual can renew in a number of ways. So they can mail the packet back to us. They can walk it into their local county assistance office, or they can complete it over the phone, or additionally, they can complete it online like we talked about for Compass.
Once the renewal has been submitted, the eligibility determination can start.
There's a couple of things that can happen. They can be eligible or they could be ineligible. Either way, they're going to get a notice from the department indicating the result of their renewal. So if a person is eligible, they'll continue on their coverage and they'll receive that notice telling them that that's happening. If they're ineligible, they will receive a notice that says they're no longer eligible for coverage, but it'll also tell them why. If a person thinks that we made a mistake at DHS and they don't agree with the decision that we've made, they can appeal. And that information is located in the notice of how to do that.
If for some reason you miss the renewal deadline, DHS says it's never too late to return your renewal.
When individuals are unable to complete the process by the deadline, and for some reason we close them in that process, they have a 90-day window from the date of that closure to then be reconsidered without having to resubmit a new application.
The state agency wants to make sure everyone is aware of the renewal process so they can stay covered.
The DHS goal throughout this entire process is really to keep Pennsylvanians covered. We want to make sure that everyone in Pennsylvania has the medical care that they need when they need it.
If someone is determined ineligible for Medicaid or CHIP, DHS will refer them to Penny, Pennsylvania's official health insurance marketplace. And we will discuss more about Penny later in the show. Back to you, Valerie.
Thank you, Deborah. Secretary, what help is available for people who are going through the renewal process for the first time?
Well, we know this process can feel a little daunting or a little overwhelming. So people can get in-person assistance at our county assistance offices. They can call our customer service centers and they can do the entire process over the phone, including with language translation if they need it. And there's also many community groups that we're working with who can provide free help. And we also want people to know that the help with this is always free. If somebody is trying to charge you for this help, that's a scam. Anybody who is supposed to be helping you, has the knowledge to help you, would not be charging you for this help. And people can go to that same website, dhs.pa.gov/staycovered, to find out what the phone numbers are, where the county assistance offices are.
Very good tips there. So what can Pennsylvanians do right now to get ready for their renewals?
Right now, the most important thing that people can do is make sure we have the most up-to-date contact information. So by going to that website, they can check their renewal date. Renewal dates are individual, or unique to each individual, and will be over the course of this next year. And then they can check to make sure we have the right mailing address, phone number, email. They can even sign up for emails and text messages so that they'll get alerts by those ways when their time is due.
And what happens if someone does not complete that renewal in time?
Well, unfortunately, if they don't complete it at all, we will have to close or discontinue their insurance. But they have 90 days to get back to us. And we know some people are just going to overlook the paperwork. But if they go to their doctor's office or they go to the emergency department and are told they're not covered, if it's within 90 days and they're still eligible, we can just turn their insurance back on. If it is past 90 days, they will have to fill out another application. But again, we'll work with them to make sure that gets completed.
Thank you, Secretary Arkush. And if you have any questions about benefits or to find your renewal date, you can reach the DHS Customer Service Center at 1-877-395-8930 or 215-560-7226 in Philadelphia. For help renewing your Medicaid coverage, please visit your local county assistance office or call 1-866-550-4355. Time to check in with Deborah Pinkerton on our live web chat tonight. Deborah, what are some of the questions being asked?
Valerie, we are getting a wide range of questions coming in. Here to answer some of the questions is Lexi Dyson-Roth, Executive Assistant for the Pennsylvania Department of Human Services. Here is the first question that we've received. My parents get their health care through the state. How can they tell if it's Medicaid or Medicare?
Well, the easiest way to tell if it's Medicaid or Medicare is to give us a call. You know, if you're not sure what kind of coverage that you have, those customer service center numbers that were just mentioned are really great resources. So the statewide customer service center number I have here is 1-877-395-8930. So those numbers are going to come up a couple of times tonight, I think. And then we also have a dedicated number in Philadelphia, and that number is 215-560-7226. And then one of our dedicated employees will be able to assist.
Okay. We do have another question that came in. It says, I completed my renewal for Medicaid and I was just notified that I am no longer eligible. So what are my options?
So first, I want to thank that chat entry for completing their renewal. That's the first step to connecting people to the right coverage for them. So once somebody completes their renewal and maybe they're no longer eligible, they'll safely and securely be forwarded to our partners at Penny. Our partners at Penny will be able to look at different coverage that is at low cost or no cost to them.
Okay, thank you so much, Lexi. We will be talking more about Penny. That's coming up after the break. But if you would like to submit a question, you can visit our web chat at abc27.com/staycoveredpa. Stay with us. We will be right back.
Pennsylvanians need to renew their Medicaid or CHIP coverage. Make sure you're ready. Losing your benefits could be costly. When she slips and lands in the emergency room. When you get sick and need time to recover. When you need to make sure they're taken care of like they always did for you. Or when you're working to build independence. Stay covered. Get ready to renew your Medicaid or CHIP benefits.
Paid for with Pennsylvania taxpayer dollars.